Good morning, everyone. This is Jeff Willett, Vice President for Programs with the Kansas Health Foundation, and with me today is Elisa Buller, our Grants Officer. And we're going to be providing an overview of the Foundation's Healthy Living Grants, RFP. We'll provide an overview of what we're looking for in the RFP proposals and the basic requirements for the RFPs and the application process. Before we get started, I just want to point out that all lines are on mute. We have a number of people on the call today, and just to ensure that we minimize any background noise, we decided to mute all of the lines. There will be an opportunity to ask questions toward the end of the call, and to do that, you can use the question box feature through the webinar to submit your questions. If you're not online or you're unable to submit a question through the question box feature, you can email in your questions after the webinar. And the webinars are being recorded, and any written questions and answers from today's webinar will be posted along with questions we received during last week's webinar and through email on the Foundation's website. And Elisa will show you where you can go to find the questions and answers. Smoking and obesity remain the leading causes of preventable death and illness in Kansas, costing our state over $2 billion annually in unnecessary health care costs. Nearly 1 in 3 Kansas adults is obese, and 1 in 5 smokes. Among Kansas high school students, 1 in 10 is obese, and 1 in 5 smokes or uses other tobacco products. The problems of obesity and tobacco use are increasingly concentrated among Kansans of lower socioeconomic status, further compounding health and economic disparities in our state. For example, 1 in 3 Kansas adults with less than a high school education smokes compared to only 1 in 10 adults with a college degree. Rates of obesity are also significantly higher among Kansans with household incomes less than $15,000 compared to those with incomes over $50,000. According to the Trust for America's Health, Kansas ranks 43rd nationally on per capita funding for public health, and as a result, there's relatively less funding for implementation of obesity and tobacco prevention programs in Kansas compared to most other states. Through this request for proposals, the Kansas Health Foundation will fund organizations to implement evidence-based strategies that promote and support healthy living in Kansas, specifically activities that support one or more of the following: healthy eating, active living, and/or tobacco use prevention. The Foundation is particularly interested in strategies that will improve the health of low-income Kansans or other populations disproportionately affected by obesity and tobacco-related chronic diseases. And it's important when you think of the purpose for the RFP that you recognize that the purpose is to fund implementation of evidence-based strategies. And this slide just attempts to stress that we are expecting these grants to be implementation ready. We're expecting these funds to support action-ready activities, and these are not planning grants. And for the purposes of this RFP, evidence-based strategies refers to those that are recommended by leading health organizations or otherwise supported by strong research and evaluation findings. We are particularly interested in evidence-based strategies identified by Kansas stakeholders, and these could include strategies that were identified during the 2012 Kansas Obesity Summit, strategies related to the Kansas State Chronic Disease Plan, or strategies related to the Kansas Healthy 2020 process. To be considered for funding, applicants must clearly demonstrate that proposed activities are implementation ready and evidence-based. There's also a strong preference through the RFP for funding strategies that lead to or are related to policy systems and environmental interventions, or PSE interventions. Pages 1 and 2 of the RFP outline this preference and provide examples of policy systems and environmental interventions. The RFP also discusses the difference between PSE strategies, and programs for individual behavior change. And in the funding requested for programs for individual behavior change or community design construction must be clearly connected to PSE interventions. We will not award grants that are solely for program implementation or construction/design projects. With regard to who may apply, the Foundation anticipates receiving proposals from a wide range of organizations. It's important to recognize that grants are not limited to community-based efforts. If you are an organization that works at the statewide level, or if you have a project that would have a statewide impact, you are certainly encouraged to apply for the Healthy Living Grants. To ensure sustainability, applicant organizations' annual revenue minus any existing grants from the Foundation must exceed the requested annual amount. With regard to available funding and the grant period, there is a maximum $100,000 award through this grant. Applicants may request less than $100,000 for the project, but $100,000 is the maximum for any individual award. And that is the total amount. That does not refer to an annual funding amount. So $100,000 is the maximum award. And there's a maximum 24-month grant term. However, again, applicants may request a shorter grant term if they do not believe they require 24 months for the proposed activities. The Foundation anticipates awarding a total of up to $2 million through this RFP. With preferences for funding, these are not requirements of the RFP, but they are our preferences, and all other things being equal, we will certainly take these preferences into account when we are making decisions regarding grant awards. Preference will be given to proposals that clearly demonstrate a strong multi-sector approach, or strategies that leverage or build upon efforts funded by other state, federal, or Foundation grants, and as I mentioned earlier, strategies that will improve the health of low-income Kansans or other populations disproportionately affected by obesity and tobacco-related chronic disease. Because we recognize that there are companies that are actively promoting, marketing, and selling tobacco products and other products that are not healthy, to avoid any real or perceived conflicts of interest, the Foundation reserves the right to not fund organizations that have contracts with or receive funding from, including grants or sponsorships, a tobacco company or soft drink manufacturer. And applicants must include a signed statement with their proposals describing any financial relationships with tobacco companies or soft drink manufacturers. Please review the RFP to look at the full list of grant exclusions. We just wanted to highlight 3 important exclusions during this webinar. First, lobbying. The Foundation funds cannot be used to support lobbying activities. However, there are a wide range of non-lobbying advocacy and education activities that may be supported through the Healthy Living Grant Awards. As I mentioned before, programs for individual behavior change and community design construction will not be supported unless they are clearly tied to specific policy systems and environmental interventions. And I encourage you to carefully read the RFP where it references programs for individual behavior change and community design construction to have a better understanding of what we mean by those terms. I'm not going to go over this in detail. This is the table summarizing the proposal requirements sections and the scoring per section. The majority of your grant proposal will be submitted as a narrative response to most of these sections. However, there are important attachments and templates that you must complete and attach to your proposal for it to be complete. Those are outlined in the RFP, and Elisa will give you examples of several of those. And then finally, just an overview of the timeline. Obviously, we are at the second RFP conference call today. The next milestone is a letter of intent, which is due on February 25th. We will not review proposals from organizations that did not submit a letter of intent by that deadline. The proposals are due March 28th, and we anticipate announcing the grant awards by April 30th, with the grant term beginning June 1st of 2014. And just a little bit more regarding the letter of intent. Again, we will not review proposals submitted by organizations that did not submit a letter of intent by the deadline. The letter of intent is helpful because it allows us to structure our review process and to ensure that we have enough reviewers for the proposals. We will not be making any funding decisions based on the letter of intent other than it being a requirement for submitting a complete proposal. In the letter of intent, you need to clearly identify the name and address of the applicant organization along with the primary the primary contact person's contact information. Again, to help us structure the review process, we need you to identify the focus area or focus areas that will be the subject of your proposal and provide a brief, no more than 2-paragraph overview of the proposal so we have a general idea what you will be submitting. The proposals will be reviewed by external stakeholders and experts in chronic disease prevention, so this information helps us ensure that the proposals are reviewed by people who are knowledgeable about the work that you're proposing. So with that overview, I'm going to turn it over to Elisa before we open it up to questions.
Thank you, Jeff. What I'm going to be reviewing this morning is our website as well as the online proposal process. So first I'm going to open it up to our website. If you haven't been to our website before, it's kansashealth.org. And from the home page, you can get to a link for our Healthy Living Grants RFP. What you're seeing right now is that page for our Healthy Living Grants. One of the first sections that we have is we're listing the link for the RFP itself, so you can access that document on the page under the second paragraph. And then where it says informational webinars, as Jeff mentioned, we are recording this webinar and we will be posting the recording and posting it by middle of this week. So if you want to go back and listen to the webinar, you can go ahead and do so on this page. Next section is for our proposal instructions and templates. There's 3 templates underneath this section, and those templates will be completed and uploaded to your online proposal. And then also just mentioning the due date again for the application, which is March 28th, and they must be submitted by 5 p.m. Once that 5 p.m. deadline does hit, we will take the link offline, so you will not be able to access the proposal. So please make sure you get started before that time. Another thing I want to mention, if we go to the top of the page, there's a little blue box on the right-hand side. The first link is for the FAQ. That's where we're capturing all the questions that we're receiving either through webinars or emails or phone calls. So you might want to check back on that link every once in a while just to see the questions that have been received and the answers. And then we also have a link to the goals for the 2012 Kansas Obesity Summit. So those documents are provided on the right-hand side of the page. And now what I want to do is just go over the online proposal process. So on the very bottom of the page, you'll see there's a link that says Healthy Living Grants Initiative Online Proposal. That link will take you to our online proposal module where you'll first see the sign-in page. So if you've never used our online system before for submitting a proposal, you'll need to create an account by clicking on the new applicant link underneath the email field. However, if you have used our online system before, you'll just need to enter your email address and password. So I'll go ahead and enter my email and password and select the login link. And this will then take me to the online proposal. As you'll see at the top of the page, there's a number of different sections that will need to be completed before submitting. So this first page is the cover page. And the first few boxes we're asking for information on the organization that's applying. So the organization name, address, city, website, and then the information for the primary contact of your organization. So who's the president or executive director of that organization. And then towards the bottom, we'll ask a couple other questions, with one being what's the project start and end date. So once I finish that page, I'll select the next button. And this is where we'll upload our proposal narrative. So on page 4 of the RFP, that's where it outlines all of the questions that you need to answer in your narrative. And so once you fill out that narrative on a Word document and you're adhering to the page limits as described in the RFP, we'll need you to upload that document. So what you would do is you'd save your Word document to your computer, and then I would find on my computer by selecting the Browse button. And once I find my proposal narrative, I'll select the Upload button, and it'll upload my document, stating the date it was uploaded and the size of my document. So once I've uploaded my proposal narrative, I'll go to the next page, which is the budget and justification page. And first I'll enter the amount that I'm requesting from the foundation for my project or for my proposal. So if I was just going to request $95,000, I would enter $95,000 in that field. And then we'll ask you to upload a budget and justification template. So if I go back to our website under the template section, you'll see there's a link for a budget and justification template. So once you fill out that template, again, you'll save it to your computer, and then we'll go back to the online application, browse for it, and upload it to the online proposal. Once I finish that, I'll go to the next page. This is where you'll complete the financial relationship statement form that Jeff mentioned. Again, I'll go back to the website under the template section and fill out that financial relationship statement template, and then go ahead and upload it to this page. Next, I'll go to the Acknowledgement of Agreement review page. And this, again, you'll go back to the website, click on this link to upload the Acknowledgement of Agreement review form. And this document is basically saying that you would accept to the terms of our grant agreement if you were to receive a grant from the foundation. So our grant agreement template is provided in the next section on our website. So once you've reviewed our template, reviewed it with any financial or with any advisors, and you've reviewed the terms and you accepted those terms, you would go ahead and sign off on that Acknowledgement of Agreement review form. Now, if you have any questions as you're reviewing that grant agreement template, you can go ahead and contact me, and my contact information, again, is in the RFP. So once you've signed off on that Acknowledgement of Agreement review form, you'll upload that document, and then we'll go to the next page, which is the Attachments page. And on the Attachments page, we're asking for a number of financial documents. So if you're applying as a 501c3 organization, we'll need you to upload those 3 financial documents. However, if you are a government organization, you will not be required to upload those documents. So if I was a 501c3 organization, I would scroll down to the very bottom of the page in the Upload section and click on the title of the document that I wanted to upload. So if I wanted to upload my unaudited financial statement, I would select that title, and then I would go through the same process as we have with all of the other documents that we've uploaded by browsing for the document on your computer and then clicking the Upload button. Now, once you've finished filling out your online proposal, you would need to select the Review and Submit button. And this Review and Submit button is going to take you to one last review of your proposal. And once you have reviewed everything that you've put together and you're ready to submit it, there will be a Submit button at the bottom of the page. And once you hit that Submit button, you'll get an automated email from us letting you know that we have received your proposal. And again, all announcements will be sent by April 30th. And then I just want to go back to our website one more time. If you have any questions just with that online proposal module, questions about uploading a document or how to log in, any questions regarding the online proposal process, you can contact Gina Hess. She's our grants associate, and her contact information is at the very bottom of the page. And now what we're going to do is open it up for the questions that we've received that have been typed in the questions box. If you have any questions, please type those in. We'll read them off and answer those questions.
And just before we get started, we will not answer questions about specific proposal topics or proposal ideas because it's honestly very difficult for us to understand what's intended by a project through this Q&A period. But we will work through the questions. The first, what does PSE stand for? PSE stands for Policy, Systems, and Environmental Strategies. Those strategies are described in the RFP, starting at the bottom of page 1 with specific examples listed at the top of page 2 of the RFP. The next question, are community gardens considered for funding? Wanted to clarify it isn't considered community design construction. Well, that's a good question. So again, there are many different aspects to community gardens. Often there are policy changes that are required to gain access to land for community gardens or to ensure that there is an adequate water supply for community gardens. And then there also may be costs associated with preparing the land or fencing an area that has a community garden. So with community gardens, there certainly are policy components that may be necessary, and there are certainly construction type costs that are also associated with them. So in the proposal, you will have to clearly outline what it is that you're hoping to accomplish, and we will score the proposal based on your information. There is a question regarding whether, well, if an organization currently has funding from the foundation for a Healthy Communities Initiative grant, would that organization be eligible to apply for a Healthy Living grant? Yes. Organizations that receive funding already from the Kansas Health Foundation are eligible to apply for Healthy Living grant funding if they meet the basic eligibility requirements of the RFP.
Another question we have is, can a group use the Chamber's 501c6 to send the grant application through? We can only, eligible organizations would only be 501c3 organizations or government entities. So if you wanted to work with a 501c3 organization, you'd have to apply under that group. Another question we have is an audited financial statement required for all nonprofits? Our organization is small and only 4 years old. We have not had the funds to pay for a full audit. We do have a financial oversight policy. If you don't have an audited financial statement, go ahead and upload the documents that you have, and then we'll review those documents.
There's a question regarding if a school district has a contract with a soft drink company, will it be automatically excluded from consideration? The requirement is for all applicants to submit the financial relationship statement and indicate, describe any financial relationships with tobacco companies or soft drink manufacturers. It's difficult to know whether anyone would be eliminated from consideration without understanding the relationship and the proposed activities. However, if you are proposing to reduce the consumption of sugar-sweetened beverages, it would likely be a conflict of interest in our minds if you have an existing contractual relationship with a soft drink manufacturer. If you're proposing something in the physical activity area, such a relationship would not be as great a concern. Is there a program officer to contact or a person at the foundation who is available to answer questions about specific proposals and whether they are consistent with the goals of the funding initiative? Given the strong interest in this RFP and the likely number of applicants, the foundation staff will not be discussing in detail specific grant ideas. So there are points of contact. Elisa is listed as the point of contact for the RFP. If you have questions, please submit them to Elisa, and we will answer questions as we are able to. But there will not be an opportunity to have an in-depth conversation with foundation staff regarding any specific proposal idea.
This is just a follow-up question to the question on the 501c6. So just to be clear, can the organization submit through the city municipality? If that's considered then a government organization, yes, you can. If it's a C6, though, no, you cannot.
Questions. Is this funding primarily for county, city, and state policy changes? Can a small nonprofit that creates internal policy change apply and be considered? Yes, a small nonprofit or other organization that creates and implements internal policy change can be considered. The RFP is not limited solely to county, city, and state policy changes. Could you provide information about a previous winner of this funding as an example? This is the first time that the foundation has issued this specific request for proposals. There are no previous awardees for this proposal. I would encourage applicants to look at the foundation's website to see the type of initiatives we have funded in the past, and also to look at the CDC's, the Center for Disease Control's community transformation grants for additional examples.
The next question we have is, can an organization which is only required to file the postcard from the IRS Form 990 for 501c3 is eligible? If your applicant organization's annual revenue minus any existing grants from the foundation exceeds what you're requesting, yes, you can. So just make sure that your organization meets those guidelines.
Is there a required annual meeting for awarded grantees? If yes, is there a time of year it is planned for? No, there is not a required annual meeting for grantees. Let's see. Will the foundation consider applications from different organizations within one community? Yes. And then here's a question from a community that has multiple grants from the Kansas Health Foundation. So would both the Healthy Communities Initiative and Food Policy Council in the same community be eligible to apply, or would they have to work together in one proposal? Again, the foundation will consider applications from multiple organizations within one community. So we would encourage you to use the approach that works best for your community. And at this moment, those were all of the questions that were submitted. There were a number of questions asked on Friday's webinar, and as Elisa pointed out, those questions and answers are already posted on our website. We will work to quickly post the questions that were asked during today's webinar. I think if there are no other questions, we will let you go. Again, the webinar from today's, the webinars will be recorded and posted on our website along with the Q's and A's. Submit any additional questions to Elisa using the contact information provided in the RFP. And thank you for your time this morning and your interest in the Healthy Living Grants. We look forward to your proposals. All right.